All right, let's turn to some health news this morning. And me and my next guest were just talking about that there's no doubt maybe a little COVID fatigue going on right now, but it's still so important to really make sure that our families are staying as safe as possible this year as we get into the fall season, cold flu season. Joining me this morning from BayCare, Dr. Anand, the Executive Vice President and Chief Medical Officer. I know how busy you must be, Doctor, but thank you so much for taking some time with us today.
Yeah, it's my pleasure, Carly. It's a fun time of the year with Thanksgiving and Christmas coming on, so it's my pleasure to chat with you, and we can hopefully give people some guidance on how to stay safe.
Yeah, and it is a slippery slope here because I feel like we are getting COVID fatigue. I think there's been so much talked about, but you can't do it enough. Again, there's just so much coming up here that we really want to make sure that our family members and our loved ones are safe. So what do you want people to keep in mind and really know as we get into this time of year, Doctor?
Yeah, I think, Carly, you're absolutely right. I mean, there is a healthy amount of COVID fatigue, but I think the most important thing that I always tell people is that we want you to stay healthy, we want you to be safe, and we want you to be safe with your loved ones when you can. And so as we think about this year, there's a couple of things, especially as we round out the rest of the year, that we should keep in mind. One, the same things that have always been important to keep you healthy are still important. Get adequate sleep, eat a healthy diet, get exercise when you can. Also, another thing, as we get closer into mid-November and into late November, this is flu season for us in Florida. Typically, mid-November all the way to a peak in February is when flu season tends to peak, and it's a perfect time right now to start to get your flu shot if you haven't already got one. Talk to your primary care physician about it, and just know that it can be disruptive to you if you get the flu shot. One, you could expose a loved one to the flu. Or second, you could actually disrupt your own life, because if you're coughing, we've all had instances where people have been coughing or sneezing in a meeting. They're not going to know if you have COVID or if you have flu, and imagine the disruption that could cause.
Well, and let's talk about the flu shot, because there's a lot. Florida, I feel like, is so different from the rest of the country, right, with our weather. And when is the best time to get the flu shot, do you think, Doctor?
Yeah, Carly, right now is the best time to get the flu shot. I always advise the month of October, mid-September till now is the best time to get the flu shot. If you haven't got the flu shot, the best time is that day to try to go out and get that flu shot. You don't want to wait too long, because flu tends to start ramping up in mid to late November here, and it really goes into full effect in February. So if you haven't got it, please get it. The sooner the better.
Now, I know just kind of in some of my circles, there's been some talk about the flu vaccine and making sure that it doesn't interfere with COVID. I mean, how can you make sure that people know that this is still maybe the best decision to do? Obviously there's no guarantees, but what would you say about when it comes to COVID and flu and getting the flu shot?
Yeah, there's a lot of myths out there, and I always say, the flu shot is something that people have been getting for years. It's a relatively safe vaccine that's out there, so I always say get it. It's not going to interfere with COVID at all. It actually will help you prevent getting symptoms that may be confused for COVID. So now's the time to get it.
What's your take home here as we, again, we want to be able to celebrate. This has been a tough year for a lot of people. We want to be, respectful and again, spend time with our loved ones. What do you want them to know really and take home with them today as they're watching?
It has been a really tough year for folks, and we want them to spend it with their loved ones. The most important thing is stay healthy. Stay healthy, stay healthy. Again, focus on sleep, diet, exercise. If you haven't got a flu shot, make sure you get it. And if you do have to go, remember the same thing. Masks can save lives. Wear a mask so that the individual you are with will be safe, as well as yourself. Social distance when you can, and wash your hands frequently. All those things will pay off. And that way people can enjoy their life and live a healthy life and enjoy it with their loved ones as we go into Thanksgiving, into Christmas.
And if families have questions about things, where would you send them, Doctor? Where's kind of a good place to start with getting the resources that they need?
Yeah, we know that people have a lot of questions. So we set up a website called BayCare.org, and you can go into there. It'll help answer any questions you have about the flu, about coronavirus, about other health questions that you have about traveling. And so it's a great resource for you. So I would highly recommend that website. If not, you can always go and reach out to your primary care physician. They can help you as well.
Well, Doctor, we certainly know that this has been quite the year for you and your team. We appreciate you taking some time with us this morning. Stay well, stay healthy, and we really appreciate your time.
You as well. My pleasure, Carly. Thank you.
And of course, we'll put all those details on our website too.